Well, our study showed that there's a lot of room for improvement. Looking at international comparisons, for example, Sweden often comes in rather low, 10th or even 11th out of 11 countries that have been studied in terms of issues like coordination of care, in terms of patients getting the information and education that they need in order to be engaged patients. And when we look across Sweden as a whole, we see that there really are big differences. In some of the counties, performance is much below what we see in the best performing counties. And ideally, we'd like to see the worst performers do as well as the top performers, and we'd like to see Sweden do as well as countries like the United Kingdom, for example, which has a similar sort of healthcare design as Sweden.
We definitely saw progress in terms of information and education. There's a lot of positive things that we can point to. The 1177 information portal is something that's been well regarded. It's being increasingly used. Nevertheless, it's very clear that patients aren't getting the kind of individual information that is promised to them in law, the kind of information about choice, about guarantees, about opportunities to engage with their providers and choose among different treatments. This slide shows international comparisons. You can see that Sweden is the darker green bar there. Only Norway performed less well than Sweden in a recent study of 11 international sicker patients who use the healthcare system quite frequently. And this is questions like, does your doctor provide you the information you need? Are you able to get answers to your questions? Are choices presented to you in a way that you can understand? So opportunities for improvement abound here. And importantly, we have the specific information about what's working and what's not. Are patients treated as individuals, or is there a sense that there's a bit of a cookie cutter medicine, just applying it to, here comes the patient, we'll do what we're supposed to do? Or are we really looking at an individual and saying, this is an individual who has a unique set of needs, we'll treat them and respect them as an individual? We found that there are some problems here, and that these problems, in fact, are leading to demonstrable costs to patients as well as to the public health system. Again, here's the international data. Look at Sweden, the very last bar. 42% of patients surveyed had the most favorable responses according to a number of questions. This isn't just one question, this is several questions about respect and being treated like an individual. And look at the difference between the United Kingdom, our top score. 74% of patients had the highest performance across these categories. Only 42% of Swedish patients. Room for improvement. And we heard from our patient experts that it's still the case in Sweden that healthcare seems to be organized for the administrative convenience as opposed to the individual patient. What does the patient need? Is this a patient-centered delivery system? Are we designing our hours so that we're available to patients? Are we giving patients the choice that they need, that they want? And we found that no, providers said they're dissatisfied, patients said they're dissatisfied, and there was a pervasive sense that if it's working for anyone, it's working for those who are administering the system.
One of the things that surprised me quite a bit was the finding that there is, in fact, such a great disparity across the country in terms of performance. And we heard this from the experts that we interviewed, that the healthcare you get in Sweden really depends on where you live. And going into this study, I was aware that Sweden has puts a strong value on equity. And so I was surprised to see that there was such a tolerance for differences in this really important area across Sweden.